Good morning, everyone. Good morning. There we go. I'd like to extend my gratitude to Sean Vincent, President and CEO of Loyola Medicine, for hosting us this morning and for his partnership in fighting the opioid pandemic that's plaguing our community and our country. I'm grateful to Emergency Management and Regional Security Executive Director Bill Byrne, who's worked diligently to ensure that the Department of Justice funds are distributed to communities and organizations that need them most. Thank you to Dr. Mark Cichon for administering the law enforcement Narcan program. Your work has saved thousands of lives over the course of the program. And finally, I want to extend my gratitude to the Riverside Director of Public Safety, Matt Buckley, and the public safety professionals who have gone through this program and are using their training on the front lines. The opioid epidemic in this country is taking a staggering toll. The number of lives lost and families destroyed rises with each passing day. Cook County is not immune to this crisis, and our statistics prove it. Our medical examiner's office logged more than 1,000 opioid deaths when we launched the law enforcement Narcan program in 2018. In 2020, the medical examiner's office confirmed more than 1,800 opioid overdose deaths, almost twice as much. And the deaths are occurring disproportionately in our black and brown communities. These numbers tell a grim story, and they also showcase just how vital the work of our partners at Loyola Medicine are. This is why our Department of Emergency Management and Regional Security is awarding the Edward Byrne Justice Assistant Grant to Loyola Medicine to continue their work to provide first responders with the training and tools they need to save the lives of opioid victims. Cook County is awarding more than $458,000 to law enforcement agencies and not-for-profit organizations to help ensure the safety and security of our community. This year's grants will go to fund body-worn cameras and police vehicles, as well as a carpentry program designed to stop recidivism. Loyola Medicine's program to stem opioid deaths remains a critical priority for us and a vital component of our Department of Justice grant funding. It's now my pleasure to introduce Sean Vincent.
Good morning, everybody. Good morning. Thank you, President Preckwinkle. We are very proud to host this important announcement by Cook County here at Loyola Medical Center today. As the President and CEO of Loyola Medicine, I am honored to accept the grant that you are providing today, which will help us address a solution for opioid abuse in our communities. We've enjoyed a wonderful working relationship with President Preckwinkle and Cook County on many issues in our community, but none is more important than one that will save lives before it's too late. In 2018, Loyola Medicine and Cook County Department of Emergency Management and Regional Security partner to provide vital Narcan training to police officers, fire, and EMS personnel to combat the opioid crisis. As the Level 1 Trauma Center, Loyola has a long history of working with first responders in our community to support our mission as a healthcare provider. As an academic medical center, we have a legacy of teaching, and this program allows us to teach others to save lives, just like our emergency doctors, nurses, and caregivers do every single day. Putting an antidote to opioid overdose in the hands of our first responders and training them how to properly use it has and will continue to save countless lives. The lives of our neighbors, our family members, and even those that are most vulnerable in our community, our children. This is needed even more as many have turned to opioids to escape social isolation, economic challenges, and social inequalities over the past year due to the COVID pandemic. Saving lives requires teamwork and cohesion at the highest level, and we are proud to collaborate with Cook County to stop overdoses and opioid abuse in its tracks. This program created a standard of care and consistency from one police department to the next, so we can tackle the crisis together. I also want to extend our special thanks to all of the first responders and law enforcement personnel who put their lives at risk every day. They have relentlessly supported our communities and have partners to our frontline workers during the most difficult year. We have battled together like never before and are here to support you, just as you have protected us. Thank you again, President Preckwinkle, for your foresight so many years ago, funding this other pandemic to prevent opioid deaths in our community. Next, I'd like to present Mr. Bill Barnes.
Good morning.
Good morning.
I want to thank Madam President for your leadership and support of this very important program, one that we have been spearheading in support of Loyola Medical for the past 3 years. Also like to thank Loyola Medicine President and CEO Sean Vincent and Dr. Mark Sean, who you'll be hearing from a little bit later. Both of them have dedicated countless hours to overseeing this very important law enforcement Narcan program. I'm also excited to introduce later Director of Public Safety for Riverside, Matt Buckley, and all the first responders who have participated in this program and gone on to save lives in the field. My department, Cook County Department of Emergency Management and Regional Security, has been administering the Edward Byrne Justice Administration grant for about a decade. And in doing so, we've been supporting law enforcement and also not-for-profits in our communities. And when we receive projects seeking funding through this JAG grant, we look to see how we can make the most meaningful impact that we possibly can in our communities, with a focus on the communities that need our help the most. So over the past 10 years, these funds have provided a number of resources for law enforcement throughout the county, suburban Cook specifically, with a target to those communities that couldn't afford those resources on their own. This year, as in the past, we're also expanding JAG grants to not-for-profits that have a particular nexus with justice-impacted communities. So this year, we're funding a veterans training program and 2 programs that are focused on reducing recidivism. But of course, we're here to talk about the law enforcement Narcan program, one that's administered by Loyola Medicine, and a program that has literally meant life or death to so many people in our communities. This program has provided training and the Narcan drug to thousands of police officers throughout the county over the past 3 years, and in turn, those thousands of officers are better equipped to respond to our communities and their residents. To tell you more about this program, I'm proud to introduce Dr. Mark Sean to describe it. Doc?
Good morning.
Good morning.
Thank you, President Preckwinkle, Mr. Vincent, Mr. Barnes, and Chief, for joining me here. 3 years ago, we partnered with Loyola's with Cook County Department of Emergency Management to launch the first train-to-trainer law enforcement Narcan project. Since then, we've trained approximately 3,000 law enforcement first responders from 34 different municipalities. They recognize the symptoms of an opioid heroin overdose, and they've been taught to act quickly to administer the Narcan nasal spray. Narcan is effective and quickly blocks opiates, including heroin, fentanyl, hydrocodone, oxycodone, morphine, methadone, from the receptor sites in the brains that suppress the respiratory drive. This has saved countless lives. There's never been a greater need. Unfortunately, this past year, the stress, anxiety, and isolation that's been seen with the COVID-19 pandemic has contributed to a skyrocketing opiate overdoses and deaths within our community. We know that our first responders are often the first on the scene of an overdose, and that administering Narcan as quickly as possible can mean the difference between life and death. We are grateful to Cook County for providing Loyola with another Edward Byrne Memorial Justice Assistance Grant, which will allow us to provide Narcan training to an additional 3,000 to 4,000 first responders. Through this grant, we will also be able to purchase tourniquets for our first responders, which is another vital tool in helping to save lives. With that, I'd like to introduce Matt Buckley, the Riverside Director of Public Safety, to come and speak.
Thank you very much. I'd say good morning, but I think it's been said a bunch of times already. But good morning. Good morning. And thank you for asking me to come here. I cannot thank Loyola Hospital and Cook County enough for providing this program. I don't have a script written out because what I'm going to talk about just took place 3 weeks ago. Riverside Police were dispatched along with fire and EMS to a report of a subject walking down a street that appeared to be under the influence. As I was pulling up right behind the first officer, the subject was now unconscious, laying on a front lawn. As the officer walked up, he did a quick evaluation and assessment of this person, and they showed indicative signs of somebody under the influence of an opioid. He immediately got his Narcan, which they carry on their person, and administered 4 milligrams of Narcan to this subject. We saw almost an immediate reaction with this. At the time when he was laying there in the grass, very shallow breathing. He was turning cyanotic, means turning blue, which means he wasn't moving air properly. After he received his first dose of Narcan, his color started coming back very quickly. His respiration started to pick up very quickly. By the time we had him loaded onto the stretcher, he was talking to us again. So this is a person that was, definitely under the influence of heroin. He told us once we got him in the ambulance, he had just snorted heroin. He says he's addicted. He turned out to be a very nice person, a person who you would see on a daily basis walking down the street. He wasn't a criminal. He wasn't a thug or anything like that. He was a normal person. And when we talked to him in the back of the ambulance, and he told us how he got addicted on heroin, it only takes one time of using it. And he was able to, we had a very nice conversation, but what happens with Narcan is when you give that first dose, you may have to give follow-on doses also because the heroin stays in your system. The Narcan only works for a little while, which is an addiction issue. This program to us is so important because it gives hope. It gives hope to those people. Those are the folks that sometimes didn't have a choice. Over my years, and I am a product of the Loyola program for issuing out Narcan, I have personally issued Narcan to patients. There is one that sticks out very clearly to me, and it was a younger individual. He was in college. He was a baseball player, hurt his knee, had multiple surgeries to rebuild his knee. Over time, they started cutting back his medication. Well, unfortunately, he turned to something else to help with the pain, and that was heroin. Unfortunately, we had him, he overdosed on heroin multiple times. We were able to get there quickly, issue Narcan, and bring him back. But it's amazing how the heroin is so prevalent out there. And it's something you don't always hear about every day. But having a program like this one through Loyola Hospital where we can get that Narcan in the hands of the first responders, the police officers, the EMTs and paramedics, the firefighters, is so important because that's what makes the difference. I've been working with some of our state legislators. We're trying to pass legislation right now to get it where if a doctor prescribes any of those products that could potentially act as heroin does, that they also prescribe a dose of Narcan for the families to have. So that way, if something does happen where that person takes too much of their medication, the family is there able to give Narcan right there in the house before police and fire and EMS gets there. So having those things in place are so important, and we will continue this process. I am so happy to hear that Loyola is going to continue this program. I just had a call from a neighboring police department who got called to a party, and they had 4 people who were overdosing at the same time on heroin, and they used up all their Narcan. So they were looking for a resupply and who to call and things like that. Now I can give them a direction to go, because having that out there is so important to all of us. So I thank you very much. I appreciate this. For everybody that took part in this program and awarded this grant to Loyola Hospital to continue this very important program. Thank you.
Thank you for your personal testimony. All right. I think we have some folks on the line here. We're going to start with Alice.
Hi, good morning.
Good morning, Alice.
Just to make sure I have the numbers right, is the JAG grant a total of $458,000 that Loyola will administer to law enforcement and nonprofits?
Could you explain how many? I think it's 10. All right. The question is, how much money is it, and how much are we giving to Loyola, and how much are we giving to other actors or organizations?
Yeah, hi, it's Bill Barnes. The total amount I don't have on me, it's over $450,000, and I believe we're giving $60,000 to Loyola Medicine to continue this program.
All right, Alice. So $60,000 goes to Loyola, and it's a total of about $458,000, I think. Okay. What's your next question?
Okay, and do you know how long the grant is projected to last?
Okay, how long is the grant projected to last, Bill?
The grant has, I believe, a 2-year cycle, but it's issued every year through the Department of Justice.
Okay, and do you have a list of the departments and nonprofits that are part of this partnership?
Could you repeat the question, Bill, and then just...
She asked for a list of all the partners that we're working with in administering this grant. I don't have it on me, but if you reach out to us, we can get it to you. Yeah.
Okay.
It'll be, Natalia just indicated that it will be in the press release, the list.
Okay, awesome, thanks.
Sure.
All right, Alice, do you have any further questions?
No, that's it. Thank you.
Thank you. Alex?
Hello. You were saying that this program has existed, this relationship between Loyola and the county since 2018. Can you talk a little about what specifically this new grant is going to change or expand in terms of the way it operates?
All right. So, Dr. Cichon, the question was, we've been supporting this program at Loyola since 2018. How is the new grant different from past support?
The game plan with the new aspect of the grant is to expand the reach. This is the supplies that were purchased through the first grant is basically what consumed the dollar figure. The educational programs that we put on as a teaching institution were within our community contributions, and we trained the trainers, meaning that each department had a individual who was the trainer to all the other policemen. Just because of the various shifts and the way the duty assignments, it makes it difficult for us to send an individual to train every member. We had over 3,000 first responders from 34 different agencies, both municipalities as well as private groups, security groups that were trained initially in the grant, and the ask of others has been kind of challenged by the fact that the funding was completely utilized for the purchase on that first go-round. This will enable us to do more.
Thanks, and I'm wondering if maybe Director Byrne can clarify the source of the funding. You said it was a grant from the Department of Justice. Is this like a regular annual grant that EMRS has access to?
Yes, the question is the source of the funding.
Yeah, hi, it's Bill Barnes. Yes, this is a grant that's administered by the Department, or it's issued by the Department of Justice, and we are a sub-grantee through the City of Chicago. We apply for it every year, and we've been receiving it for well over a decade, and the expectation is to continue to receive it in the future.
Okay, thank you. And I have one off-topic question if there's time to return.
Yes, Alex, what's your off-topic question?
Sure. Madam President, I wanted to see if you wanted to respond to Mayor Lightfoot's comments from yesterday about basically sort of renewing her earlier comments about judges letting defendants out on electronic monitoring or bail, basically saying that's contributing to gun violence in the city. And specifically, she said, I'm not in charge of electronic monitoring because if I were, that issue would be solved. I just wanted to give you an opportunity to react or respond to that.
Well, I think I've been quite clear in the past that I believe that's a false narrative. The challenge we have in law enforcement is that police officers are often seen as oppressors in communities rather than public servants. And that makes it very difficult to get the information that you need to solve violent crimes because people won't cooperate with the police. And unless and until we improve the relationships between community residents and police officers, we're going to struggle with solving violent crime. And, you know, those communities that are the most violent are also the ones that are most disinvested. If you look at what we call a social vulnerability index, do you have access to quality health care? Do you have access to grocery stores? You know, what's the unemployment rate? Is it high or low? What's the quality of your public schools? If you look at the social vulnerability index, those communities that are struggling the most with these issues are the ones that are the most violent. And they're also the ones which are over-policed, hyper-policed, and we have the tragic consequences that we see now. I mean, furthermore, this is an extraordinarily difficult time for individuals and families. The uncertainty around health, you know, people worried about getting the disease, the economic collapse that followed the outset of the pandemic. All of those make this an extraordinarily challenging moment. And you've seen an increase in violence and murders all across the country as a result. It's not unique to our city or our county or our state. So in this extraordinary moment, you can either acknowledge the circumstances, try to explain them to people, what's happening and why, and what you're going to try to do about it, or you can point the finger at other people. And unfortunately, that's been the mayor's standard operating procedure. Blame others.